Hey guys, Dr. Rob here. So this is a quick video on everything H. pylori. So first off, we have to understand this organism has been with us for 30,000 years. It is an expert at living in your body without being destroyed and detected. So it has the capacity to burrow deep into your stomach lining or intestinal lining, stay hidden from your immune system. Second, it has the ability to get into your vagus nerve through the stomach and affect your brain. It can affect your mood. It can affect food cravings. It can make you depressed. It can make you anxious. It can cause a whole lot of nasty symptoms. In addition to that, H. pylori, when combined with Klebsiella bacteria, can be associated with rheumatoid arthritis or the onset of that autoimmune disease. In addition, when it combines with staph bacteria, it can be connected to lupus, to scleroderma, to burning mouth syndrome, and other types of autoimmune conditions. In fact, H. pylori itself can be a contributing factor to leaky gut that can cause any type of autoimmune disease. In addition to that, H. pylori can affect gut neurotransmitter levels, causing it to control your gut essentially when your stomach contents empty, when they don't empty, when you're going to be hungry, when you're not going to be hungry, particular types of foods that it wants for survival. Now, detecting H. pylori, traditionally endoscopy was the gold standard. The problem is H. pylori can colonize in different parts of the intestinal tract. In fact, there was an old teacher of mine, Dr. William Timmons, the original creator of BioHealth Diagnostics Labs that's now out of business. He and his fellow colleagues actually, they cultured H. pylori from the male prostate gland. So crazy. This bug can go anywhere in the gut, and that's the problem with detecting it, is it can stay hidden from endoscopy. It might colonize one area of the gastrointestinal tract, but not the other, so now you can't find it, right? Unless you sample that exact spot it's in, you're not going to find it. Also, it has almost like a cloaking device, not really, but it can be hard sometimes for the immune system to find it, so it can stay hidden or dormant until the environment is right. Again, it's been with us for 30,000 years, guys. This thing has learned to evolve with us. Other testing procedures. H. pylori stool antigen study is good. Urease breath test is good. You can do other more alternative bioenergetic studies. Those, of course, are non-diagnostic, like we do a nanoscan in the office. You can also do other types of testing procedures that are not necessarily diagnostic, but they can give you feedback. And the reason why those bioenergetic procedures can be important is because sometimes the bug eludes the normal procedures. So we might have a patient that on H. pylori stool antigen, they're negative. On urease breath test are negative, but then we do a DNA stool analysis for H. pylori and it comes back significantly positive. So we know if there's a lot of H. pylori DNA present in the person's stool, they probably have H. pylori, right? So we have to get creative in identifying this bug. And now the treatment, oh God. So we have antibiotics, which are really, really rough. But the other things we have natural things that we can do to help with H. pylori. And I'm not going to claim these as treating because the FDA is very clear that these things are not used to treat, diagnose, cure, or prevent any disease. But there are things like zinc L-carnosine, mastic gum, oregano oil, certain forms of beneficial bacteria that can be effective in knocking out or helping support the body in getting rid of the H. pylori bacteria. I had it years ago. After I killed my H. pylori naturally, my sinus problems went completely away. The horrible heartburn and reflux that I had years and years ago, that went away. My restless leg syndrome, that went away. It was all within like a couple weeks of starting my natural H. pylori protocol. So I hope that condensed a lot of information in a short bit. If you have more questions on this bug, please feel free to direct message me or whatever, and I'm happy to help how I can. See ya.